Many people who take medications, both prescribed and over the counter, actually know very little about them.
And that's not good. According to our guest on this week's Health Talk, he says that people need to understand more about their medicines, starting with why are they taking each one of them.
So stay tuned for a very informative segment. We're up next.
Hello, I'm Dr. Eric Mazur.
And I'm Dr. Andrea Peterson. We can't overestimate how important it is to understand the medications you're on. Bob Bepko, who's the Administrative Director of Pharmacy Services with the Western Connecticut Health Network, is here with us today to underscore this key message.
Well, you're the star of Health Talk. I know
really
people
are.
love it when you come on the show because they always learn things that are important to them. We're talking about knowing what you're taking today and why you're taking them.
Right.
Tell us a little bit. Why is that so important? The doctor's taking care of me, isn't she?
It's important for patients to know why their physicians are prescribing medications, why they're taking it, what the drug is for, and if I take it every day like I'm supposed to, if I take anything else, will that interfere with that particular medication?
You know, I think we all think a lot about medicines that doctors prescribe as being very powerful and having potent side effects. But when it comes to things that are on the shelf in the pharmacy, things that we imbibe every day like alcohol, vitamins, stuff in the health food, we don't think about that stuff as having side effects or being potent, do we?
We don't. And I think because people are not taking a particular product out of that brown medicine vial that has a label on it, they think perhaps it's not a medication. However, we need to talk about that, and especially with taking medication and alcohol.
I've often mentioned to patients that anything you're taking that can have an effect can have a side effect or other effects. And that's really important to think about.
So, you know, a lot of people, their physicians, they'll go to their physician and they'll say that, you know, they're sluggish, they're feeling down, their mood is not like it used to be. And a physician may try a dose of an antidepressant. And the patient takes it and a couple weeks later feels absolutely terrific. And the medication is clearly working. However, you know, that medication is altering your chemistry inside you to make you feel better. And if you were to start drinking alcohol again or increasing your alcohol intake, you're actually neutralizing the effects of that, positive effects of that medication. So you're taking a medication that's boosting you up, and then you're self-defeating yourself by taking a drink of alcohol or several drinks of alcohol, and you're neutralizing the effect of the medication. So why take it in the first place?
Alcohol is a depressant.
Yes, it is.
Many people don't realize that.
Right. So you have an antidepressant that you're taking, your physicians are prescribing for you, and then you take a depressant. So all you're doing is canceling out the positive effect of that medication, and you're probably feeling worse.
Are there dangers besides feeling worse? Are there dangers of alcohol and certain drugs?
If there's been a lot of news lately where you'll see celebrities that were taking antidepressants, pain meds together, mixing them, and then going off on an alcohol binge. And unfortunately, a lot of times it proves fatal. And it's tragic because they're self-defeating everything, the whole purpose of trying to feel better.
Somewhat related medications we might talk about are medications to help relieve anxiety. So medications we call benzodiazepines.
Benzodiazepines.
Mother's, and actually from the 60s, Mother's Little Helper.
Right.
That's the Valium.
Valium, Librium, Ativan, Xanax.
They were ubiquitous in the 60s.
Everybody was taking them. Everybody. And unfortunately, again, powerful interactions with medication, with alcohol. And so you need to be careful.
and in that case work in somewhat similar ways to alcohol, so you're getting an overly sedative effect,
which
can really render people
It's really
unconscious
amazing,
in very
Andrea. When I was in
difficult
medical
situations.
school and Valium was just, or the benzodiazepines were just coming on the market, they thought they were so safe. I remember this specifically. One of our instructors said the only way you can kill yourself with X, with the benzodiazepine, is to smother yourself under a pile of pills. That was absolutely wrong, we've learned. They also cause dependence.
Yes.
I mean, bordering on addiction.
On addiction.
So these are not simple medicines, and I think people are backing away on using them a lot more, but they're particularly, actually, I think Xanax, which is one of the more popular ones, because of its biochemical characteristics, is one of the most addictive.
Yes, absolutely.
While we're talking about alcohol, we've been talking about prescription medications that can interact with alcohol either by counteracting its effect or by increasing its effect. Maybe you can talk about a very common over-the-counter medication, acetaminophen, which has particular interactions with alcohol.
Acetaminophen, again, for viewers at home, is the simple Tylenol, which people think is non-toxic.
Yes. And again, depending,
can be very effective
when taken as correctly ordered, it works great. It doesn't irritate the stomach. It'll take that headache away. It'll take that minor ache and pain away. But then when you start mixing it with alcohol, it turns into something else. And you're going to have the ability, depending upon how much you're taking, to cause liver damage. Again, the alcohol coming into play with an over-the-counter drug.
One of the things that worries me so much about acetaminophen or Tylenol is how easy it is to get up to toxic thresholds inadvertently, because it's buried in so many over-the-counter products. So, yeah, could you say a little bit about that, and even talk about the absolute amounts that one should take in a day? Because I think people don't realize sometimes how close to the edge or over it they're walking.
And it can sneak up on you how much you're taking. You know, you see the capsules, the tablets, and it's pretty straightforward on the labeling. It's either 325 milligrams or 500 milligrams.
The extra strength.
Right. And at 500 milligrams, you want to keep away from, because you take a couple of those tablets or capsules, that's a gram of acetaminophen.
And you don't really want to take more than about, what is it, 4 grams a day?
4 grams a day.
And yeah, I just...
Less if you repeatedly ingest alcohol.
Yes. And so the challenge with taking the acetaminophen or the Tylenol is that it's very soluble. So a lot of liquid preparations that are over the counter,
the cold, fever, and flu medicines, a lot of them have acetaminophen.
It's in that bottle, and it's probably running around the 500 milligram strength per teaspoon, and it's in that small labeling, so you can't see it.
Another class of pain relievers, you mentioned that acetaminophen does not irritate the stomach. Other pain medications may irritate the stomach. How about something like ibuprofen, Advil, Motrin?
Yes.
In terms of safety and alcohol.
Right, and a lot of people that again, because these products are both prescription strength and over-the-counter, you can take the over-the-counter stuff, a couple of tablets, and get a prescription strength.
That's right. There's nothing that keeps you from taking it at a prescription level just because it's over-the-counter.
So people with chronic pain that rely on these over-the-counter or the prescription strength of these medications, and if they start to drink, because they have the ability to irritate the lining of the stomach, then you're drinking alcohol on top of it.
And that can irritate the lining of the stomach.
That can be very irritating. And the two physicians here can talk about how the GI bleeds as they've treated through their careers, and it's not a pleasant situation for the patient.
There are 3 things that I'm sure Andrea's seen a lot of, that I know a lot about, having to do with those class of pain relievers. GI bleeding, which again is exacerbated by alcohol. Kidney damage. There's all sorts of data about people that take this stuff over the long term too much, and there's even heart attacks. There's a third body of knowledge that these things are not completely benign. They're great drugs, used selectively, used under the supervision of I think a physician if you're going to use it regularly. But these are not benign drugs,
especially when you mix it with alcohol.
Now, what if you're taking a prescription medication and you're going to a big party that may last a couple days over the weekend? Should you stop your medication for those couple of days while you're drinking alcohol?
I would suggest you not stop the medication. It's more important that you take it. And you know, club soda, some non-alcoholic drink is more than enough to you know, to get you through that.
And if you're not a teetotal, you know, moderation. It's
moderation.
And
is
if you have
the key.
a question, ask the doc. You know, there are certain drugs you can't take anything with. You can't take any alcohol with them. I guess a metronidazole, an antibiotic, is one you don't want to take alcohol, and it will say that on the bottle. But you know, common sense. But people who think that they are immune to any kind of damage are just wrong. How about blood thinners? There are so many new blood thinners on the market now, and they're being used a lot, and they're incredibly effective,
very effective,
great drugs. But how about their use with alcohol?
Well, again, it's you take the whole class of blood thinners, the warfarin type, the warfarin, Coumadin. You mix that with alcohol, and it's really a recipe for disaster because it's thinning your blood, and if the alcohol should be irritating the lining of your stomach, you're setting yourself up for a bleed, and it's
we
not
know that
good.
You can actually retch, you know, dry vomit, if you will, from alcohol and put a tear in your esophagus and bleed a lot. It's something called a Mallory-Weiss tear. That can be a big time bleed.
So you're taking the warfarin, the Coumadin, the blood thinners for a particular reason, whether you have a heart condition, whether you had a blood clot, whether you just had surgery and you've got to take something to prevent a clot for the next several weeks. Why put yourself at risk? Is it worth it? Is it worth it to you to start mixing alcohol with your medication?
Why don't people talk more to their doctors about alcohol and their drugs? Why is there this mystery?
Well, I think most people don't consider alcohol a drug. That's number one. Two, why do I have to tell my doctor if I'm having a cocktail or something? I'm here to talk to him about my meds. And you got to understand that alcohol is a medication.
Last drug class that I'd like to talk about are antihistamines.
Yes.
Because again, they're ubiquitous. We use them for allergies. They're in virtually every sleep medicine you buy over the counter. Tell us about those.
You know, living here in the Northeast, you see those pollen counts on the TV sets, you know, in the morning, and you know, we're going to have a ragweed problem today and stuff. And everybody runs to get an antihistamine that unfortunately suffer from hay fever, those type of allergies. And they can and will make you drowsy. Mm-hmm. And then if you have some alcohol on top of it, again, you're potentiating, you're making them work together. Separately, they're okay, but you put them together.
Yeah, don't
it's
take
not
a
good.
Benadryl and have a drink to get to sleep at night.
Absolutely not.
Bad idea.
You know, we've run out of time, and we could talk about this all day.
So important.
So I want to thank our guest again, Bob Bepko, for joining us on Health Talk.
This was such an important show. Please send Eric and me your questions and comments by emailing us at healthtalk@wchn.org. We'd love to hear from you.
Thanks for watching, and remember, know your medicines and know what you're using beyond that.